Hello and greetings to everybody looking in at the ISGE website. I'm Dr. Ellis Dowes, I'm a gynecologist in London, and I'm speaking to you from a wonderful city of Osaka, Japan, where we are for our annual convention. And it's a great pleasure to be talking with Dr. Shawki from Egypt, and he's taken a few minutes out of his busy schedule to update us on some of the growing advances in operative laparoscopy. Dr. Shawki, what sort of instruments are new that we should be aware of?
Well, thank you, Ellis, for the nice introduction. First, I welcome all the ISGE members and all over the world who are interested in endoscopic surgery, or what we call it, the endo world. Well, basically, we cannot say that endoscopic surgery is a recent specialty. It exists since a couple of decades now. But, in fact, the instruments and technology invested in this new kind of surgery is still growing up and catching up. It's not like in standard surgery since the 1800s. Forceps is the forceps, scissor is the scissor, nothing new can be added now. But in endoscopic surgery, more indications, more techniques necessitated new designs and instruments that can fulfill certain steps in surgery. So that's why I allow many minds, innovators, to add more and more. Every month you hear about new instruments, that allow new technique in an easier way.
So what are the sort of new instruments that operative laparoscopists want to know about?
Well, you know that everybody knows in operative laparoscopy work from a keyhole. You have only two holes or a little bit one more to introduce instruments. So in any procedure like laparoscopic hysterectomy whatsoever, sometimes you need a forceps, then a scissor, then you have to exchange instruments every now and then. And exchange of instruments consumes time. There's a little bit of scale of carbon dioxide, and most importantly, when you exchange instruments, you have to take the camera a little bit back, a little bit in. This readjustment takes time and confuses you from focusing on the field of surgery. So, my main concern was to find that instrument can do many functions without the need to take it in and out. And that's how you invent. When you feel that you're in need, you think, why not to turn this a little bit or to make this longer? That's what happened to me. So, during a step, for example, you want to cut into tissues, adhesions. So you want to cauterize, control the blood supply in this area, cauterization, and then you remove the cautery forceps and you go with a scissor to cut, and so on. So exchanging instruments was a little bit cumbersome to me. So what I did, I combined both jaws in one instrument. This part is a forceps. You can catch, you can dissect, you can coagulate, okay? And this part of the blade is a sharp, very sharp titanium scissor. So you coagulate and then you proceed to cut. While you're cutting, if you want to coagulate the next step, you can catch. So you are doing two steps in one.
So, I mean, that sounds pretty exciting, a multifunctional instrument.
Cutting, coagulation, forceps.
Can you use it on laparoscopic hysterectomy?
I have a beautiful, convincing video to show it. I mean, if you have a new product, you want to convince customers, you have to show them in reality, not just diagrams. So I have many videos for LAVH, for cholecystectomy. My colleagues use it in the cholecystectomy, cystic artery, okay? In adhesiolysis, in ectopic pregnancy, because the instruments give you the versatility. You can use the tip like a laser blade. You can dissect, you can catch, coagulate, and cut, okay? So all this allows you to focus in one step of in the surgical procedures. And if you have two instruments of these in two ports, actually you have 4 blades.
Right. 2
forceps and 2 scissors.
Well, I mean, I think that sounds very exciting, but I'm sure there might be some people watching our interview who personally feel quite unhappy about electrosurgical diathermy for larger blood vessels.
Yes.
In your new instrument, have you had any difficulties in this regard?
Well, I thank you very much for this question because you give me the chance to answer it. We tested coagulation of this instruments on the renal vessels and animals, okay? Big renal vessels, okay? And then when it's coagulated, then we try to push water under pressure to see to what extent it will withstand the pressure. We went double, triple, up to 700 millimeter mercury, and then the vessel, the sealing burst. So you can confidently trust it up to 7 times the blood pressure that the power of sealing of this instrument is okay. I have to confess that there's only one disadvantage of this instrument for the moment. The models available in the market now, can I say the name of the producers? It's Carl Stores. Open the catalog, you find Shawki cutting coagulation force. It's a monopolar. And I know that my fellow colleagues in the United States, they hate monopore. I don't know why. Okay, so it's now up to now it's a monopore, but they're developing a modified one with curved ends with a bipolar that people will be very happy to use it safely.
Yeah, I mean, there's a big controversy about monopolar and bipolar. Some people say that monopolar is dangerous. I personally say monopolar isn't dangerous, it's for people who use it. If they don't know how to use it properly.
Exactly.
I feel very comfortable using monopolar, and I'm sure a lot of people would.
Exactly.
Well, it's been great spending a few minutes here in Osaka talking about electrosurgical energy.
Osama. In Osaka with Osama.
In Osaka with Osama.
My name is Osama.
Okay, we better go back to the conference and see what's happening. But thanks so much for a wonderful few minutes. See you later, folks.